All right. Oh, thank you, Dr. Travers. That was wonderful. We'll shift gears a little bit now today to talking about sort of the clinical and treatment world. So hello again, everybody. Thanks for having us. We're really excited to be here. We are going to talk about a really essential question today, one that is maybe overly used and little understood. This question is, how are you feeling? And we all have different answers to this question. So we'll talk about managing feelings in an overwhelming world through the lens of autism spectrum disorders, or ASD. And a note, I'm going to kind of follow up to Dr. Travers' note about language. So this sort of language context is ever evolving in the autism community. As a treatment practice, what we do with individuals and families is we ask and have a dialogue in session about language and use the language preferred by every individual person. So because of that, when we refer to people today, we're going to be using the language that they identified. So it could be identity first or it could be person first, but we definitely honor the research that Dr. Travers referenced. All right, so my name's Madeline Barger. I'm a board certified behavior analyst, licensed marriage and family therapist, and certified sex therapist with the American Association for Sex Educators, Counselors, and Therapists. I'm the lead for programming and treatment for teens and adults in the Weissman Autism Treatment Programs in partnership with UW Health. And my other half at work and my wonderful co-presenter today is Dr. Alyssa Walsh. She is a licensed psychologist and she is the lead for school age programming and treatment in the autism treatment programs. So we work really closely together in the behavioral treatment context, wherein we often spend a lot of time disproving myths and about feelings, and of course using science, evidence-based curricula, and then really importantly empathy and compassion. So while we support families, oftentimes families are on a journey towards mutual understanding and then the behavior change that they come seeking. So Alyssa's now going to talk through our agenda for today, and she and I will go back and forth as we go through this.
Let me see, just make sure it's working. There we go. Thank you so much, Madeline. And thank you very much for having us here today. So as Madeline mentioned, this is an overview of what we plan to discuss today during our presentation. And then we look forward to answering any questions that you might have. So we'll begin with a brief overview of the processes involved in an emotional experience, and then we'll discuss various skills involved with identifying emotions, both in oneself as well as in others, and how we support teaching and practice of these skills. We'll next talk about ways to manage strong emotions and stress, including strategies to try to proactively reduce stress, as well as steps to take to try to manage stress in the moment. And then we'll end our presentation today discussing the connection between emotions and relationships.
Alyssa, sorry,
Yes.
I'm going to interrupt for a second. If you could just slow down slightly for the interpreter.
Yes, I certainly will. Thank you, Clark.
Thank you.
All right. So what we are going to talk about today is based on evidence-based techniques from treatment, as well as experiences reported by folks on the spectrum regarding successful ways to talk about, learn about, and navigate emotions. Many people with and without an autism diagnosis seek supports for managing emotions. And what we have found is that there are unique experiences and strategies that we found to be most effective for individuals on the spectrum. All right, so there is not a universally agreed upon definition of emotion, as they are rather complex and there are different theories about people's emotional experiences. However, one definition of emotion from the American Psychological Association reads, in part, that an emotion is a complex reaction pattern that involves experiential, behavioral, and physiological elements by which an individual attempts to deal with a personally significant matter or event. So to break that down a little bit further, there's some type of stimulus that occurs in the environment that is significant and meaningful to a person in some way. And that can either be in a pleasurable way or in an unpleasant way, leading to either a positive emotion or a negative emotions or multiple emotions. Now, the stimulus itself that we experience can be happening in the moment. It could be something that we are imagining or a relived experience. And it's really important to note that the same event that happens can lead to different emotions in different people. We don't all have the same reactions to an event that occurs, and our own history of personal experiences and culture impacts how we interpret something. So, for example, Madeline and I might both hear the same song at the same time, and it might lead to different emotional experiences in both of us. And both emotional experiences are valid, right? So perhaps her past history, she's had a positive association with this song, and it leads to a positive emotion or happiness. And perhaps for me, I've had a different history in listening to this song and different associations, and perhaps it leads to sadness for me. So same event, same stimulus, but different emotional experiences in different people. All right, so now we're going to talk a little bit about the science of emotions. And research has identified that there are different areas of our brain that are involved in recognizing and experiencing emotions. When there's something that occurs that is emotionally meaningful to us, there are involuntary physiological reactions that occur via the autonomic nervous system that leads to changes in different parts of our body, including our heart rate, our breathing, our salivation, our digestion. And the autonomic nervous system, and more specifically the sympathetic nervous system, controls that fight or flight response that happens when we perceive there to be a threat or stress or something harmful. And then in response to this perceived threat, our brain really quickly processes this information and leads to these different changes in our body. So perhaps our heart rate increases, our bladder relaxes, our pupils dilate, amongst other changes that happen very quickly. And then the parasympathetic nervous system controls the rest and digest response that happens when we're more, that is ongoing when we're more in a relaxed state. All right. So another part of our emotional experience is our expression of emotions that involve behaviors that are often observable to other people, which is useful from a social perspective to let others know how we're feeling and what we might do in different situations. One behavioral response involved in an emotional experience is an automatic and involuntary change in our facial expressions, including changes in muscle movements in our eyes, in our cheeks, in our eyebrows, in our mouths. So for example, if somebody feels surprised, it's possible that their eyes are wide open and their mouth is open, and their eyebrows are raised. We also express emotions through other parts of our body, such as our body posture, and we tend to be more relaxed or rigid during different types of emotional experiences. Furthermore, we express emotions through what we say and how we say something, such as the tone or volume of our voice, or more nonverbal sounds too, such as like a gasp. And then finally, we express emotions through the actions of our body. For example, if somebody is afraid, they might jump or move away, or if somebody is feeling angry, perhaps they clench their fists. Feelings of emotions are those conscious, private experiences of emotion that we have and that we often label, such as, I feel happy or delighted or angry. And there's different thoughts that accompany these feelings and emotions.
Thank you, Alyssa. So we'll shift gears a little bit and think about what to actually do with this information in our everyday lives, and then also in a treatment or clinical context. So Alyssa talked about our physiological internal sort of experiences and events related to emotion, and then what other people can observe. But when we go to apply this to our everyday lives, especially when people come into treatment and they want to work on emotionally relating to others, which is really something we can all use some work on, and it's a practice for our whole lives. But when this is really the focus of treatment, we need to find an applicable way to address it. So we can't always, for at least for me, I can speak for myself, and I know other people have said, we can't always really directly relate our internal physiological experience to an emotion. Some people are really good at this and other people aren't so good at it. So identifying our emotion is the first step in really emotionally relating to other people. And there are three primary ways, in almost sort of an experiential way, that we can look to figure out what are we feeling. So because we're all different, we all have different intensity, or either the presence or the absence of one of these three sort of ways that we can identify or associate with our emotions. So I'm going to use the same stimuli that Alyssa talked about, which is a song. Maybe a song plays. Okay. So that's our stimuli. So in the treatment context, some people may really hear this song and feel good, and that's a physical sensation, and then they know, oh, I'm happy. I can identify that my emotion is happy. So the stimuli was present, the song I can hear, I feel good, and I'm happy. And their feeling might be like a butterfly feeling in their stomach. So those are folks that are really attached to this physical sensation. People will tell you, my chest is tight, so I know I'm anxious. My stomach has butterflies, so I know I'm happy. Another way that people may report primarily associating with their own emotions is an environmental experience. So there are people where they hear the song and they don't know maybe that they're happy or that they're feeling positive until they really experience that stimuli externally for a while. Okay, so maybe they don't even feel butterflies in their stomach. They might be butterflies in there, but they don't feel them. They're really associating with what they observe in their external environment. And then finally, there are thoughts. And this is kind of a common one. So it might be, I hear that song, I think I love that song, then I feel happiness and I can identify that emotion. So you can see where this is really individualized and sometimes complicated, but it is worth really taking the time, especially when people come to us in the treatment context, as I said, looking to relate to other people. We start with, how do we identify our own emotions, which is really a personal practice beyond just what are all the emotions one could have. Okay. Now, once we've identified those emotions, we move on to what to do about it. Okay. So the example I'll use next is the stimuli of my COVID-19 pandemic office space that I'm in right here. So throughout the day, I work in my small office space that I've created in my home, and I may feel lots of different emotions, just like we all do. So there are four main areas that we can work on in behavioral treatment about what I can do once I've identified my emotion. Okay, so let's say I have an emotion that is uncomfortable to me. Okay, a feeling, physical feeling, and an associated emotion that I don't like. One thing I can do is take steps to make a change in my own behavior. So maybe when I'm sitting in one spot in my office, there's a draft and I don't like that. And it makes me uncomfortable. It stresses me out, negative feelings for me personally. So then I can change my own behavior. I can move to a different spot. Okay. But if I can't identify that emotion, I might not know what I'm upset about or even take that step to make a change in my own behavior. So next, I can change my environment. Okay, so let's say I notice that I'm feeling really frustrated when I'm working on a project and my eyes are hurting. So another experience of negative emotion. So I could dim the light in my office space, change that environment once I've identified that emotion. Finally, let's pretend for a moment that we're not in the middle of a pandemic and Alyssa and I are sharing my office space safely. One environmental change or change I could make once I've identified an emotion is to advocate for change. So let's say Alyssa is clicking her pen really loudly. I notice that I'm frustrated, and then I can ask her, hey, Alyssa, can you stop clicking your pen? And because Alyssa's great, she'll say, of course. So that's a socially mediated way that I can work with my identified emotion and then advocate for change. And then finally, the fourth one that we often forget about is that we actually have to work when we feel good and when things are going well to keep things the same. So it's not enough to have this cozy little mini office space here in my.
Oh, I think Madeline was just muted. There we go.
Hi, folks. So I think what happened there is one of the participants accidentally unmuted their mic, and in an effort to fix it, the host may have muted my mic. So that's okay. I'm going to keep going. So
Sorry
we
about
have.
that.
That's okay. So we have to work within our environment to keep it the same, especially if it causes us to have positive emotional identification. So next, Alyssa is going to talk about the second phase of this. Once I've identified my own emotion, I do the work of identifying emotion in other people. So Alyssa will talk about that.
Wonderful. Thank you, Madeline. Yep. So now I'll talk about thinking about identifying emotions in others and kind of how we talk about and work on that within treatment. So being able to identify the emotions in others helps us to know how they're feeling, what they might do, and to empathize with other people as well. There are a variety of skills that are involved in identifying other people's emotions, such as labeling of emotions and distinguishing between the different emotions that other people might have. In addition, part of reading other people's emotions involves identifying those verbal and nonverbal cues in others through their facial expressions, their body actions, their body posture, the tone and volume of their voice. In addition, we want to think about the situation or the context in which the other person is in to give us information about how they may be feeling and thinking about how have we felt in similar situations, which includes perspective taking as well. We can help support the teaching of these skills through various different behavioral strategies, including discussing these verbal and nonverbal ways that people commonly show emotions. In addition to discussing these different ways that other people show emotions and responding to emotions, we can use observational methods, such as modeling, whether that be in person and modeling some of these different ways, facial expressions, body postures, body actions, or via video modeling. Another teaching tool that's evidence-based across many different skills, including emotion identification and responding to other people's emotions, is use of role plays to practice identifying emotions in other people during different hypothetical emotional situations. And importantly, we want to practice these skills both in structured role play situations that can be really useful for all of us, as well as in naturalistic situations with others, and provide feedback in the moment as well. Now, we know that people express emotions differently, and different emotional expressions can be rather subtle. It's not always really obvious how another person is feeling. And so if we have looked for all of these cues and are not sure how the other person is feeling, and we all find ourselves in these situations, what we want to do is asking how the other person is feeling, importantly, does not mean, though, that you have to manage the other person's feelings. But it does allow us to understand how that person is feeling, what they might do, and how we might be able to support that person. And we can make choices about what we choose to do in the moment.
Thanks, Alyssa. So one thing that's important is we really can't talk about feelings without talking about stress. So the visual here, I'll start by explaining the continuum of stress that we're presenting to you here. And then after we discuss the continuum of stress, I'll talk about why it's a continuum, why it's fluid. So first, on the left-hand side, you'll see an image where people are totally relaxed, maybe disengaged, or even sleepy. And there's a time and a place for that experience. In the middle, we see that people are alert, present, engaged. They may be a little stressed, but they appear to be sort of ready to learn or ready to engage. And then on the far right is a space many of us find ourselves in lately, is this is where we're maybe too stressed for learning. And the focus of our work would be on de-escalating and trying to feel a little better before we would set higher expectations. The reason this is on a continuum of stress is because it's important to think about how stress is not all bad, okay? Sometimes light stress can be channeled into useful energy or would be considered an experience of more motivation towards task completion. I even just noticed in the chat, somebody talked about survival. Sometimes stress is really helpful in our survival, okay? And that's where what Alyssa said about the sympathetic nervous system is important. That fight or flight response can help us survive. So if we never ever had any stress, we might become too relaxed. We could lose motivation. And that actually, people tell us, feels a little bit like depression, especially when that's chronic. We try our best, if we can, to relax with intention proactively, because if we never plan any relaxation or self-care, we might also find ourselves with significant mental health challenges where our brains and bodies are shutting down and dissociating. And we do actually see people report this when they're experiencing chronic stress. Okay. Now, we all kind of are familiar with if we are too alert or too stressed, it might be too hard to learn because we are doing the work of survival and maybe de-escalation. Okay. Autistic adults are actually really the experts on managing and dealing with stress because it is well documented that they may experience chronic stress. So we need to be able to have discussions about managing stress and what does stress look like. But and also note that some people don't want to talk about stress, and that's understandable. So we can look at observing people in their environment and supporting in other ways to sort of determine if a person is in a phase that's on this continuum that's not conducive to learning or working on the harder things.
Right. Thank you, Madeline. So now that Madeline has just talked about that continuum of stress, we want to talk a little further about managing stress. And there are ways that we can do that proactively to try to decrease the likelihood that we get to that far side of the continuum when we're feeling too stressed or too overwhelmed and we're not at a place for learning. And we also want to talk about strategies for if and when we do get to that place, because we all at times feel that high level of stress and overwhelm. So I'll start with talking about some of those proactive strategies. We know through reports by individuals on the spectrum that unpredictability, transitions, changes in routines, and disruptions to current activities can sometimes lead to increased stress for folks on the autism spectrum. So creating and following plans can be really useful in trying to increase this predictability, decrease unexpected changes that might happen, and thereby potentially reduce stressful situations. Developing routines and using visual schedules that outline these routines or daily activities are techniques that can be really helpful for structuring the day and trying to reduce ambiguity or having really clear ideas about what are expectations about different tasks that I'm being asked to do or that I need to do as part of my day. We also want to think about how we pair activities such as not pairing too many stressful or overwhelming tasks back to back. And we want to intersperse and schedule positive, enjoyable activities throughout our day and week. In addition, we want to consider if there are aspects of the physical environment that produce sensory discomfort or stress and that we might be able to modify. So we can think about who is present, the lighting and noise around us, seating options, and determine again if some of these modifications could be beneficial based on what triggers stress for each person.
Thanks, Alyssa. Alyssa is talking about sort of things we can try to do to prevent stress from happening. But as another person wrote so perfectly timed in the chat, someone who shared that they're an autistic adult with chronic stress. This is really true that a lot of times the people I work with in the teen and adult context are in this stressed place all the time. This is what they report. So we can't just look at prevention. We might be in this spot. So we can look at reactive measures to manage stress. And a big piece of this is being really empathic with each other because there are some things that are really hard to manage. So one place maybe to start is some people can really easily identify that they're in a really stressed place. Other people struggle to know that they're stressed and that they may need to take some measures to work on it. So step one, as we talked about, I recognize how I'm feeling. So if I'm maybe kind of dissociated or disconnected, it might be really hard for me to tell, oh, I'm actually really stressed out and I need to do something different here. So one way I can recognize this, and we're all different, is through physical sensation. So maybe I have a stomach ache and I've had one for days. Oh, I'm stressed. I can manage this. I need to figure out what to do about this. The next thing that comes up for people is thoughts. All right. So sometimes people may not feel their physical bodies at all, but they'll say, I'm having these reoccurring thoughts about how I'm never going to get this homework done or I'm never going to get this job. So then we know maybe we've hit that stress point. And then finally, other people might be really connected with their emotions. So they just know I'm there, I'm stressed, I can identify it. So what do we do about this? Um, there's kind of a cliche going around in the sort of psychology community that we've all been exposed to about just tell me how you're feeling. How are you feeling? But we've actually learned is that telling somebody how you're feeling isn't just about, oh, if I tell you, I might feel better. It's actually a behavioral cusp that opens up access to reinforcement for all sorts of other behaviors that might be helpful. So if I can tell you how I'm feeling, Alyssa, I'm really stressed, then I might be able to ask for help. Can you help me? Can you take this off my plate? Can you send me to somebody who can help me? And then maybe with or without help, I can try to change my environment. So I might have to reduce task demands. There's too much on my plate. Or I might really have to take a break. And I know that's another cliche. People say, take a break. Actually, there are science-based ways we'll talk about to identify exactly what kind of break might be useful for you. So things that come up a lot in treatment are how to manage different kinds of breaks, different durations of breaks. And some examples are physical movement, eating, drinking, listening to music, playing a video game, watching something funny, reading, fidgets, arts, and crafts. And also, I want to note that if you're finding that you're constantly in a state of escaping to a break or needing a break, you might be really overall stressed. So sometimes when parents report, well, I'm concerned that my teen or young adult might be lazy because they're always taking a break, it might actually be the opposite, that they're experiencing chronic stress and constantly looking for relief. So reactive management techniques are really important. So Alyssa will now talk about function-based stress management behavior plans. These are customized in clinic when that is the focus of treatment.
All right. So, as Madeline just described, we really want to be thinking about developing function-based stress management behavior plans that best meet the needs of each person. People experience and express stress in different ways through different behaviors and in response to different stimuli. And so, in order to provide individualized and the best supports for each person, we really want to be thinking about what is the function of the stress-related behavior or behaviors. And research has identified four main functions of behavior, meaning four main reasons that people might engage in a behavior, including stress-related behaviors as well. Now, the specific type of assessment that we do within treatment that's used to determine the function, or in some cases, multiple functions of behavior, again, including some of those stress-related behaviors, and determine the most individualized and appropriate intervention strategies is what we call a functional behavior assessment, or an FBA. An FBA is an assessment process that results in an understanding of why behaviors occur and what in the environment contributes to the behaviors that we might want to support change with. And research has found that developing an intervention plan based on an FBA leads to greater treatment success. So there's a few different parts of a function-based behavior plan, including identification of some of those proactive or prevention strategies to try to reduce the likelihood that we get to those really high levels of stress, as well as techniques for increasing the likelihood of using kind of positive coping strategies to manage such stressful situations. Another part of a function-based behavior plan is identifying what replacement behaviors or what skills might be best to teach or practice to manage stress. So what are those break options that might be individualized and be most useful and most successful for each person? And then how do we communicate those needs to other people if I'm feeling too stressed or too overwhelmed? And then finally, a third part of a function-based behavior plan is to identify how other people may best respond to somebody's stress and stress-related behaviors, again, in order to best support them and encourage use of positive stress management skills. So now Madeline will kind of talk with us next about putting this all together and thinking about emotions and relationships.
So it's possible that the point of all of this, that the question under the question is how do we explore the role of emotion in our relationships? So we have gone through science of emotions, how to identify and observe those emotions, how to do this using both science and just sort of our everyday observation. But we also want to think about what's the point, because emotion is actually really important in our relationships. So one way to think of this is that emotions might be the glue in our relational systems. The way that we manage emotions can both strengthen or weaken our relationships, and emotional experience, expression, and understanding are really important in these interpersonal relationships. Every relationship is really its own ecosystem. So, one person in the chat mentioned taking care of yourself and the relationship with yourself. So, that's a relationship. We also have relationships with friends, with coworkers, romantic relationships with partners, and then different relationships with family members. So we might have the same or different emotional responses or experiences than others related to the same stimuli, as we've talked about a couple times. And there's actually work to be done even when our emotions are the same. So, for example, if we experience the same emotion as other people in our environment, our work is to identify and validate that shared experience if we want to take steps to strengthen that relationship. So, for example, I can see that you're feeling pretty happy. I'm happy too. I'm happy about this. Let's go continue this fun activity. That sounds really easy, but it's actually sometimes hard to remember that. Okay. Next, when we think about this, we want to remember that if we can identify the emotions and navigate them when they're different, that might be even more important than when they're the same. So we experience emotions that are different from each other, from other people in our environmental system. We have to actually figure out, where do we end and where do the other people begin, which we know is kind of a tall order. So this process is called differentiation, and I do this work often with couples where one of the partners is an autistic adult and the other one maybe is or is not an autistic adult. So neurodiverse relationships, really. So differentiation is in research and literature from family therapy, and it's important that we apply this to the autistic population rather than only applying it to certain populations, because we're really missing out on a lot of learning. So differentiation is this idea that within myself, I can start to separate, and believe me, it's hard, my thoughts from my feelings. So for example, you just took my cookie. That's my thought. I'm mad at you. That's my feeling. Okay. It might be easy for those to all get mushed together, but I need to separate them. Differentiation, when I add another person to my relational ecosystem, is that I understand that I have thoughts and feelings that are different from yours. And this is something that's challenging for everybody. So maybe I'm feeling happy about something, but I can see that you're feeling sad. And I did a lot of work to be able to see that you're feeling sad. And we don't have to feel the same. So that's really important. We don't have to feel the same. These emotional differences and the way we navigate them can be a huge strength. So I don't have to feel the same. I don't have to agree. And I don't even have to totally understand another person's experience, but we can still engage in behaviors associated with emotional differentiation to strengthen that relational bond. So I have a really cool example from the treatment world that I want to share with you. So this slide we called Same Feelings, Different Brains. This is an excerpt about how a couple manages their differences and experiencing and expressing feelings. This felt really important to us to share this excerpt because oftentimes in traditional family therapy, without sort of an eye towards autism or training in the autism world, uh, these sort of differences might be seen as real challenges. There might be a big emphasis on communicate this way and not that way, those types of things. But actually, autistic adults are teaching us that we don't have to change the way we communicate necessarily to grow bonds and strengthen these relationships. So our differences are not because of some sort of skill deficit, but they're actually an opportunity to notice our strengths. So this is an example. So I have changed identifying information to protect confidentiality and got permission. And this might sound a little familiar to you because I've actually heard a lot of versions of this difference from a lot of different people when they do this couples work. So both partners entitled to their feelings. One partner in this couple dyad is an autistic adult. Both ways of experiencing and expressing feelings are valid. Okay, so I'm going to read it to you. My partner's emotions have a clear trigger from the environment and almost a memory across time. If their emotions were to be described as a physical environment, they would be a beautiful field somewhere in the country. In that emotional ecosystem, that emotional weather changes. It might rain, it might be pleasant, it's evolving. There are trees and rainbows and water buffalo and dragonflies, and not only do the animals and vegetation within that ecosystem intermingle, but they also move around. This ecosystem allows my partner to respond to the environment in a fluid and almost genius-like way. So that is an autistic adult writing about their partner. Now they transition to address their emotional experience. My emotional landscape is really different. It is a storage unit full of plastic compartments. I open one compartment and I deal with that specific emotion honorably and thoroughly, but I do not often see the point in reconciling what triggered that emotion with what is inside the other boxes. I might not notice what environmental cue comes before or after the emotion. When I'm done processing and assessing that feeling, I put it back in that container and I put that container back in the stack with the others. My partner used to think that this difference made me cold and them warm, but now we know that this is quite an efficient way and a clean way to manage our differences in our side-by-side emotional ecosystems. This has allowed me to partner with this fluid ecosystem. So that incredible strength is what we learn when we really listen, and we really listen to the answer of how are you feeling. So some final thoughts today. Even though we may experience and express emotions differently, lots of feelings, all different brains, and live in different emotional worlds, we can still see each other and coexist in harmony. It just takes some work. So now we have time for questions.